Hey y'all, it's KDG, and this is the Goldman Hour podcast that will candidly cover current events and other topics in emergency services. If you can survive the Goldman Hour, give or take, of honest and sometimes harsh opinions, stick around and enjoy a fleeting platinum 10 minutes of strict positivity. If you like what you hear, don't forget to subscribe to this podcast and check us out for more at easyemsceu.com/podcast. There's a moment in EMS nobody really prepares you for. It's not the sirens, it's not the flashing lights, it's not even the chaos of a bad scene. It's the silence. The silence that happens after everything is over, after the monitors are quiet, after the airway equipment is packed away, after the family has been told. There's a moment where everyone in the room just stops. Nobody says much, nobody really looks at each other, because everyone is thinking the same thing. Did we do everything we could? And then you walk outside, you climb back into the ambulance, you go back in service, and the world keeps moving like nothing happened. But something did happen, and sometimes that moment follows you home. Welcome to the show. If you're in EMS, you already know something about this job. People see the lights, they see the uniforms, they see the adrenaline, but they rarely see the weight. The quiet moments after difficult calls, the self-doubt that creeps in after a tough decision, the calls that replay in your mind days or even years later. Those are the stories nobody really talks about, and that's what this podcast is about. Not just medicine, not just protocols, but the real experiences behind this profession, the human side of EMS. Because behind every ambulance crew is a nervous system that absorbs everything we see. And if we don't talk about it, those experiences have a way of accumulating. Tonight, we're starting with something simple. The stories nobody talks about. Every EMS provider has a call like this, the one that lingers. Sometimes it's dramatic, like a trauma, a cardiac arrest. Sometimes it's not dramatic at all. Sometimes it's quiet, but something about it stays with you. Let me tell you about one of mine. It was late. One of those shifts where the night just felt heavy. You know the kind? The radio has been busy. Station coffee had long since gone cold, since we'd been there. And dispatch toned us out for a pediatric call. Those calls changed the tone in the ambulance immediately. Even experienced providers feel it. The quiet shift in your stomach. The awareness that whatever is waiting at that address might matter more than most calls do. In moments like that, EMS providers rely on their training because emotion cannot guide clinical decisions. So we went to work. It was a pediatric arrest, 2 years old. Probably a SIDS or a SUID case. We were called to intercept with another ambulance service, and we worked it for what felt like forever. Everything textbook, perfect compressions, airway was secured, albeit with some difficulty, likely because of downtime and presence of rigor. Medications on time. Time passed in such a strange way. Minutes felt like seconds, seconds felt like hours. Everyone was doing exactly what they were trained to do. But there are moments in medicine where despite perfect effort, the outcome just doesn't change. And eventually someone has to say the words that nobody wants to say. Time of death. We did everything right. And none of it mattered. I was just a medic student, young and nervous, excited, and ready to save the world. But what nobody talks about is what happens after they call it. They don't talk about the memories, the mother's wail and screaming, like nothing I've ever heard before. The father was out of town on business, so she was all alone. The way the room feels, heavy, silent, suffocating. The weight of carrying equipment out, arms, equipment, caught. Suddenly it's all too heavy to bear, like the emotional burden that was sitting in my chest. the normalcy of the next call. They don't prepare you for that. But we're back in service, on to the next. 15 minutes later, we were dispatched to something else, a lift assist, abdominal pain, something else. I can't remember. And I remember thinking, how is the world just continuing? I could still smell that last call on my uniform. When everything, the room, everywhere, becomes quiet after a call like that, it's a strange experience. The chaos stops suddenly. Family members cry, equipment gets packed away, people avoid eye contact. There's an emotional gravity in the room that everyone feels. And then you leave. You walk outside into the night air, you load the ambulance, you clear the scene, and dispatch gives you another call. Because that's how EMS works. The world doesn't pause just because something heavy happened. There's always another call waiting, but inside the ambulance, things feel different. Sometimes partners don't talk much. Sometimes they do. Sometimes the drive back to the station is quiet. And sometimes the only thing you can think about is the question that creeps into every provider's mind after a difficult call. Did we do everything right? EMS providers live with a unique kind of responsibility. We make decisions quickly, often with limited information, often in chaotic environments, often when lives truly depend on those decisions. And even when everything is done correctly, the outcome isn't always what we hoped for. The reality creates something that many providers carry quietly: self-doubt. Not the kind that makes someone incompetent, the kind that pushes someone to constantly reevaluate their own performance. The kind that makes someone replay calls in their head. What if we tried something different? What if we got there sooner? What if I missed something? Those questions are incredibly common in EMS, but they're rarely discussed openly. One of the things people outside the profession don't always realize is how much responsibility EMS providers carry. On many calls, you are the highest level of medical care available in that moment. There's no specialist standing next to you. No lab tests, no CT scanner, just training, experience, and judgment. You make decisions with the information that you have, and sometimes those decisions carry enormous weight. Most providers learn to carry that weight professionally, but that doesn't always mean it disappears when the shift ends. Sometimes it lingers, and sometimes the only place it shows up is during quiet moments. Driving home, sitting in the driveway, trying to fall asleep after a long shift. That's the side of EMS most people never see. In the next part of this episode, we're going to talk about something else every EMS provider experiences at some point: the mistake. Not necessarily a catastrophic one, but the moment where you realize something didn't go exactly as planned, and how those moments shape the way great providers grow in this profession. Because sometimes the calls that challenge us the most are the ones that make us better. Before we go deeper into this conversation, let's take a quick moment, because the truth is, conversations like this matter. EMS providers need places where the real experiences of this job can be discussed openly. And that's part of the reason this show exists. This episode is brought to you by EasyEMSCEU.com. Continuing education in EMS is often treated like a box to check, but the best providers know that learning never stops in this profession. Easy EMS CEU offers education designed specifically for real EMS providers. Courses focused on real-world decision-making, clinical reasoning, and the challenges we face in the field every day. If you want to sharpen your skills and deepen your understanding of pre-hospital medicine, visit EasyEMSCEU.com to learn more. Now let's get back to this conversation. The stories we're talking about tonight aren't rare. They're part of the profession. Every medic has them. Every EMT has them. Every dispatcher, firefighter, and nurse who works around emergency medicine has moments that stay with them. The difference is that many of those stories remain unspoken. Sometimes because people don't want to seem vulnerable. Sometimes because they believe everyone else is handling things better than they are. Sometimes because EMS culture historically encourages people to simply push forward. But over time, something has become clear. Ignoring these experiences don't make them disappear. Talking about them does. Talking about them does something much more useful. It reminds providers that they're not alone. There's another type of story that EMS providers rarely talk about openly: the mistake. Not necessarily the catastrophic kind, not the kind that makes headlines, but the kind that stays in your mind long after the shift ends. Every medic remembers their first one. Sometimes it's small. Sometimes it's just a moment where something didn't go the way you expected. Medication dose you had to double check. An ECG interpretation you second guessed. An airway that just didn't cooperate. A clinical decision that felt uncertain. For newer providers, these moments can feel enormous. Because when you first enter this profession, you want to do everything perfectly. You want to prove that you belong. You want to show that you're capable of carrying the responsibility that comes with the job. But medicine doesn't work that way. Medicine is complex. Patients are unpredictable. And the environment we work in is far from controlled. Mistakes, or near mistakes, happen. What matters is what providers do afterwards. This is mine. She was having a heart attack, a big one. And I remember going into this old, dilapidated farmhouse as a brand new medic, straight out of medic school, had just got my certification. And we go into this old, dilapidated farmhouse, and what I remember most about it is they had no working toilet, and there was a chicken under the dining room table. But none of that matters because she was having a heart attack, a big one. She was just weak, unable to get out of bed. And I got distracted, and I didn't think it was that big of a deal. And I didn't do a 12 lead. She was an elderly woman. She didn't really have any medical care to speak of. And she was weak. We didn't know why. She couldn't get out of bed. And I didn't do the 12 lead. She was having a heart attack. A big one. They caught it quickly at the ER, thankfully, and the lady ended up being fine. But they all looked at me like I was an idiot. And you know what? I felt like an idiot. I didn't hurt her necessarily, but I sure didn't help her. That's not really what stuck with me. It was this wave of cold shame that hit me and settled right into my spine. And there's a reason why today that mistake still sits with me. I carry it every day. But you know what I have learned and what I do now is I probably do more ECGs than I ever really need to do. But you know what mistake I'm not going to make again? I'm not going to miss it when they're having a heart attack. A big one. There's usually a moment early in a provider's career where the reality of the job truly sinks in. It's the moment when you realize the decisions that you make actually affect real outcomes. That moment can be intimidating because suddenly the weight of the profession becomes very real. For some providers, that realization creates anxiety. For others, it creates determination. The best providers learn to use that weight constructively. They don't ignore it, they respect it. And that respect pushes them to become better clinicians. There's a phrase that's becoming more common in professional fields: imposter syndrome. It describes the feeling that you don't truly belong in the role that you're in. That at any moment, someone will realize you're not as capable as they think you are. Many EMS providers experience this feeling very early in their careers. You step into the ambulance wearing a paramedic patch, people look to you for answers, patients trust your decisions, and part of your brain says, "Are you sure you're ready for this?" That feeling is more common than most providers realize. And interestingly, it's often strongest in the providers who care the most about doing the job well, because they recognize the responsibility involved. There are specific moments every new paramedic experiences. The first time they realize they're the one making the final decision. Maybe it's choosing whether to intubate. Maybe it's determining the destination hospital. Maybe it's deciding whether to initiate aggressive treatment or focus on comfort care. These moments can feel heavy because there's no instructor standing next to you, no classroom discussion, no textbook scenario, just a real patient and your judgment. Great paramedics develop confidence through these experiences, but that confidence doesn't come from pretending that responsibility isn't real. It comes from accepting it. One of the things that separates great providers from average ones is reflection. After difficult calls, great paramedics ask themselves questions, not in a way that punishes themselves, but in a way that promotes growth. They ask, what went well? What could have gone better? What did I learn? Those questions transform experiences into knowledge. Without reflection, experience can just become repetition. With reflection, experience becomes wisdom. It's time for the first street truth of the series. Street truth is where we say something directly that people might not always say out loud. And here it is. Great paramedics are not the ones who never make mistakes. Great paramedics are the ones who learn from them. Perfection does not exist in medicine, but growth does. And the providers who improve the fastest are the ones willing to examine their own performance honestly. Historically, EMS culture hasn't always been great at discussing mistakes openly. For many years, the expectation was simple. Handle the call, move on, and don't dwell on it. But over time, the profession has started recognizing something important. Ignoring mistakes doesn't make systems safer. Discussing them does. Airlines learned this decades ago. Medicine has slowly followed. When providers feel safe discussing what went wrong, systems improve. Protocols improve. Training improves. Patient care improves. Great paramedics contribute to that culture. They're honest about difficult calls. They share lessons learned. They create environments where learning is valued more than ego. Sometimes the calls that teach us the most aren't the dramatic ones. They're the subtle ones. The patient who presents with symptoms that don't quite fit the expected pattern. The case where something just feels slightly off. The moment where experience tells you to look deeper. Those moments are where clinical instincts develop. And those instincts are built through repetition, curiosity, and reflection. Great paramedics develop a habit of thinking critically about what they see. They don't just follow protocols. They understand physiology. They think about what the body is doing, and they adapt their care accordingly. At some point in a provider's career, something interesting happens. Calls that once felt overwhelming begin to feel manageable. Assessments become more intuitive. Patterns become easier to recognize. Communication with patients and partners becomes smoother. That moment isn't sudden. It develops slowly, through hundreds of calls, through mistakes, through reflection, through mentorship. And when it happens, many providers realize something surprising. They're becoming the kind of provider that they once looked up to. But even as providers grow more confident in their clinical skills, there's another challenge that develops over time. The emotional side of the job. Because EMS providers see things most people never encounter. Trauma, loss, human suffering. And these experiences accumulate. In the next part of this episode, we're going to talk about something many providers rely on but rarely examine closely. Dark humor, coping mechanisms, and the calls that follow us home. Because understanding that side of the profession is just as important as understanding medicine. There's something about emergency medicine that changes people over time. Not always in obvious ways. Sometimes the changes are subtle. A little more quiet after difficult calls. A little more thoughtful when talking about certain patients. A little more aware of how fragile life can be. EMS providers spend their careers stepping into moments most people only experience a few times in their lives. Moments of fear, moments of loss, moments where families are suddenly confronted with situations they never expected. And because EMS providers are present during those moments so often, they develop coping mechanisms. Some healthy, some less healthy. One of the most common coping mechanisms in this profession is humor. Anyone who has spent time around EMS crews know that the sense of humor in the profession can be unique. Sometimes it's sarcastic, sometimes it's blunt, sometimes it's darker than people outside the profession might expect. But that humor often serves a purpose. It helps providers release tension. It helps them process difficult situations. It creates a shared language among people who understand what the job involves. The problem isn't the humor itself. The problem happens when humor becomes the only coping mechanism. Because behind many jokes, there's still a real emotional impact. And if that impact never gets acknowledged, it can accumulate quietly over time. There's a phrase many EMS providers recognize immediately: the calls that stick with you. Some calls stay in memory because they were dramatic, like major trauma, large-scale incidents, high-acuity medical emergencies. But surprisingly, some of the calls that stay with providers the longest are much quieter. An elderly patient who passed away alone, a family saying goodbye to someone they love, a patient who reminds you of someone in your own life. Those calls don't always look dramatic on a run report, but emotionally, they can leave a lasting impression. Sometimes providers find themselves thinking about those patients days later, sometimes years later, not because they did anything wrong, but because they cared. One of the most reflective moments in EMS often happens completely after the shift ends. You finish cleaning the truck, you hand off your radio, you step outside into the quiet parking lot, and for the first time in 12 or 24 hours, everything slows down. The adrenaline fades, the constant radio traffic stops, and suddenly your mind has space to process everything that happened during the shift. Sometimes that moment feels peaceful, but sometimes it doesn't. Sometimes calls start replaying in your mind. You remember conversations with patients. You remember family members' reactions. You remember the look on someone's face when you walked into the room. Those moments are normal, but they're rarely discussed openly in EMS culture. There are several reasons EMS providers often avoid talking about the emotional side of the job. One reason is tradition. For many years, the culture of emergency services encouraged people to simply push forward. Handle the call, handle the next one, keep moving. Another reason is perception. Some providers worry that discussing emotional impact might make them appear weak, but that perception is changing. More providers are beginning to recognize that acknowledging emotional stress isn't weakness, it's awareness. And awareness allows people to manage stress before it becomes overwhelming. One of the healthiest things providers can do after difficult calls is simply talk about them, sometimes with a partner, sometimes with another provider who understands the profession, sometimes with a professional counselor trained to work with first responders. Talking doesn't erase difficult experiences, but it allows the brain to process them more effectively. And when experiences are processed, they're less likely to accumulate in harmful ways. Great EMS systems increasingly recognize this. Peer support programs are becoming more common, thank goodness. Critical incident stress debriefings are more widely available. Mental health resources are becoming more accessible. These developments are helping shift the culture of the profession in a healthier direction. Now let me tell you about another type of call that most providers remember. Not because of what happened medically, but because of the human moment within it. It might be the moment a patient holds your hand during transport. It might be a conversation with a family member who's trying to stay strong. It might be the moment someone says thank you before the ambulance door closes. Those moments remind providers why they entered this profession in the first place. Because despite the stress, and despite the long hours, and despite the emotional weight, there is still meaning in helping people during the most difficult moments of their lives. Before we move into the final part of tonight's episode, let's take a quick break. This podcast exists to have honest conversations about the real experiences behind EMS. But professional growth in this field also depends on strong education and continuous learning. And that's where today's sponsor comes in. This episode is brought to you by EasyEMSCEU.com. Easy EMS CEU offers continuing education built specifically for EMS providers who want to go deeper than just memorizing protocols. Their courses focus on real-world clinical thinking, decision-making, and understanding the physiology behind the calls we run every day. If you're serious about improving as a provider, visit easyemsceu.com and explore the courses available there. Now let's return to the conversation. The stories we're discussing tonight might seem personal, but they're actually part of the larger culture of EMS. Every provider has stories they carry. Stories about difficult calls, stories about mistakes, stories about patients who left a lasting impression. Talking about those experiences serve an important purpose. It reminds providers that they're not alone, and it helps create a profession where learning and support are valued. Because EMS is not just a technical profession, it's a human one. So far in this episode, we've talked about the emotional weight of difficult calls, the self-doubt that sometimes follows challenging decisions, and the coping mechanisms providers develop along the way. In the final part of this episode, we're going to talk about something equally important, breaking the silence, why these conversations matter for the future of this profession, and how acknowledging the real experiences of EMS providers can help make the job healthier and stronger for everyone involved. For a long time, EMS culture encouraged providers to keep certain experiences to themselves. Handle the call, write the report, and move on to the next one. That approach helped many providers get through long shifts and busy systems. But over time, the profession has started to recognize something important. Silence doesn't always make things easier. Sometimes it just makes people feel alone. When difficult calls are never discussed, providers can begin to believe they're the only ones struggling with certain experiences. But that's rarely true. In reality, almost every provider has stories they carry. Stories about the calls that stayed with them longer than expected. Stories about decisions that weighed heavily. Stories about patients that they still remember years later. And when those stories are shared, something powerful happens. Providers suddenly realize that they're not alone. One of the most valuable things about the EMS community is the shared understanding among providers. You can meet someone from a completely different system, a completely different state, even a completely different country. And within minutes, you realize something. The experiences are remarkably similar. The equipment may be different, and protocols may vary, but the human moments are the same. The anxiety before difficult calls, the same. The quiet drive back to the station afterward, the same. The conversations between partners that help make sense of what just happened. That shared experience creates a bond among EMS providers that's difficult to explain to people outside of this profession. And it's one of the reasons conversations like this matter. This podcast exists because those conversations deserve a place where EMS providers can talk honestly about the realities of the job. Not just the exciting moments, not just the technical procedures, but the human side of the profession. The doubts, the lessons, the stories that shape how we practice medicine. Emergency medical services is a profession built on experience. Every call teaches us something. Sometimes the lesson is clinical. Sometimes it's emotional. Sometimes it's simply a reminder of how fragile life can be. But when those lessons are shared, they benefit everyone. Think about the stories that you carry from this profession. Maybe it's a patient who reminded you of someone in your own life. Maybe it's a call that challenged your confidence early in your career. Maybe it's a partner who taught you something that changed the way you practice medicine. Those stories are part of the profession. They shape who we become as a provider. They influence how we treat patients, and they guide how we mentor the next generation of EMS professionals. The stories we carry matter. And reflection is one of the most powerful tools in medicine. When providers take time to think about their experiences, they gain insights that no textbook can provide. They begin to recognize patterns. They understand how decisions affect outcomes, and they develop the judgment that separates experienced providers from the new ones. Great paramedics are not just technically skilled. They're reflective. They think about their calls, they learn from them, and they use those lessons to become better clinicians. Every experienced provider eventually becomes part of something bigger, mentorship. At some point in every career, someone newer will be watching how you handle stress, watching how you treat patients, watching how you respond to mistakes. Those observations quietly shape the future of the profession, And that responsibility is one of the most meaningful parts of EMS, because when knowledge and experience are shared, the profession grows stronger. The future of EMS depends on more than just equipment and protocols. It depends on culture. A culture where providers support each other, a culture where learning is valued, a culture where people feel comfortable discussing the challenges of the job openly. That kind of culture makes for better providers and ultimately better patient care, because providers who feel supported are better able to support their patients. If you've been in EMS for a while, there's a good chance you can think of several calls that shaped your career. Some taught you clinical lessons, some challenged your confidence, and some reminded you why you chose this profession in the first place. Those experiences become part of who you are as providers. They influence how we approach the next call, how we mentor new EMTs and paramedics, how we respond to patients during difficult moments, and how we continue growing in this profession. EMS is a unique career. It places people in situations most others never experience. It requires quick thinking, quick decisions, calm thinking under pressure, and compassion during moments when patients need it most. But behind every uniform is a person who carries experiences, lessons, and stories from the calls they've run. Those stories deserve to be told, because when they're shared, the profession becomes stronger, and the providers who come after us have a little more guidance than we did. Thank you for listening to the first episode of this podcast. In the next episode, we're going to talk about something that defines great providers in a different way. What separates a good paramedic from a truly great one. The traits, mindset, and habits that shape exceptional clinicians in this profession. Until then, take care of your partners, take care of your patients, and remember that the stories we carry are part of what makes us better providers. Every once in a while, we take 10 minutes to recognize someone who represents the very best of this profession. Not necessarily the most decorated, not the most famous, but someone whose story reminds us why EMS matters. Tonight's Platinum 10 Minutes is different, because tonight we're recognizing someone whose name you'll never hear. A faceless provider. A medic who could be working in any system, any county, any city. Maybe even sitting in the cab of an ambulance listening to this right now. This is the story of a provider who faced the pressure, stress, and trauma of this job and made a decision that many people in this profession struggle to make. They chose to get help. And because of that choice, they didn't just survive EMS. They found a way to sustain it. Anyone who has spent time in EMS knows something about this profession. The public often sees the lights, the sirens, the adrenaline. But the real weight of the job isn't always visible. It's the accumulation of moments. A pediatric call that doesn't go the way anyone hoped. A suicide scene where the family arrives while you're still there. A cardiac arrest where you do everything right and it still isn't enough. Individually, those calls are difficult, but EMS providers don't just experience them once. We experience them again and again, year after year, shift after shift, and slowly, quietly, those experiences accumulate. For the provider we're recognizing tonight, that accumulation began to show itself. Not dramatically, not all at once, but in subtle ways. Trouble sleeping, restlessness, feeling on edge even when off duty, certain calls lingering longer than they should, things that once rolled off their shoulders now sticking in their mind. At first, like many providers, they told themselves it was just part of the job, because that's what EMS culture has often taught us. Handle it, move on, keep going. But eventually something changed. Maybe it was a difficult shift. Maybe it was a conversation with a loved one. Maybe it was simply the realization that the job had begun to follow them home more than it should. Whatever the moment was, it created clarity. They recognized something important. This job asks a lot from us. And sometimes the strongest thing a provider can do is acknowledge that they need support. That realization isn't weakness, it's awareness. And awareness is the first step toward healing. For many EMS providers, asking for help can feel uncomfortable. There's an unspoken expectation in this profession that toughness means carrying everything alone. But this provider did something different. They reached out. Maybe it was to a therapist who understood first responder trauma. Maybe it was a peer support program. Maybe it was to another medic who had walked a similar path. The exact details don't matter. What matters is they made the choice. And that choice changed everything. Because the moment providers begin to talk about what they've experienced, those experiences begin to lose their power. But healing isn't instant. It doesn't happen in a single conversation. For this provider, the process took time. Learning new ways to manage stress, understanding how trauma affects the nervous system, finding healthy outlets outside the job, exercise and family, time away from the constant noise of emergency response. And perhaps most importantly, learning that it was okay to talk about the hard calls instead of carrying them silently. Slowly, the change became noticeable. Sleep improved, stress became manageable. The calls that once lingered for weeks now settled more quickly. And something else happened too. They became a better provider. There's a misconception that addressing mental health somehow makes providers weak. The opposite is actually true. Providers who learn healthy coping strategies often become more resilient, more present, more capable of handling the emotional realities of this job. For this medic, the difference showed up in subtle ways. They listened more closely to their patients. They recognized when partners were struggling. They were willing to check in after difficult calls. And when a younger EMT once admitted feeling overwhelmed after a tough shift, this provider did something incredibly important. They didn't dismiss the feeling. They didn't say, "You'll get used to it." Instead, they said something honest. "Yeah, this job can get heavy sometimes, but you don't have to carry it alone." In that moment, the culture shifted just a little, because openness invites openness. There's something remarkable about providers who face the difficult parts of this profession head on, not by ignoring them and not by pretending they don't exist, but by acknowledging them and building healthier ways to cope. That kind of courage doesn't always make headlines, but it sustains careers, and it protects providers, and it strengthens the profession as a whole. This medic could have walked away, and many providers do, and there's no shame in that. But instead, they found a way to continue serving while protecting their own well-being. And because of that, they remain in the field, still responding to calls, still mentoring new providers, and still making a difference in the lives of patients every shift. The reason this story matters isn't because it's unique. It matters because it's possible. Too many EMS providers still believe that struggling with the emotional weight of the job means that they're just not cut out for it, and that simply isn't true. Recognizing stress, seeking help, learning healthier ways to cope. Those actions don't make someone weak. They make them sustainable. And sustainability is what this profession desperately needs. Because the best providers aren't just the ones who perform well for a few years, they're the ones who can continue showing up year after year with compassion, clarity, and strength. If you're listening to this right now, and some of this story sounds familiar, maybe the calls have been feeling heavier lately, maybe sleep has been harder, maybe certain scenes replay more than you'd like. If that's happening, you're not alone, and you're not broken. You're human. The same empathy that makes you good at this job also means you're affected by what you see. But there are ways to manage that, and there are people who understand, and there is absolutely strength in reaching out. Tonight's Platinum 10 Minutes goes to the medic who chooses resilience. The provider who faced the stress and trauma of this profession and decided to confront it instead of hiding from it. The medic who sought help, found healthier ways to cope, and came back stronger, not just for themselves, but for their partners, their patients, and the future of this profession. To that provider, wherever you are, thank you. Your strength doesn't just keep you in the job. It shows the rest of us how to stay. This has been the Platinum 10 Minutes. Well, folks, I'm 10-8 for now. Thanks for joining me on the Goldman Hour and for the Platinum 10 Minutes. Please don't forget to subscribe to this podcast and check out all our cool extras at easyemsceu.com/podcast and become a member of G Shift. Don't hesitate to reach out. I love hearing from my listeners, and if you send me an article or topic I use on my podcast, you'll for sure get a shout out. Until we're all 1041 together again, y'all stay safe out there.